It is my distinct honor and pleasure today to be discussing the Armenian Heritage Cruise Medical Program with Professor John Belizikian, who is well-renowned with his specialty in osteoporosis and osteomalacia. Dr. Belizikian, I would like you to first tell us a little bit about your professional life as well as experience, and then we'll talk about the medical program.
Thank you, Raffi. Well, my medical life has been primarily here in the New York area. I have been at Columbia University for my entire professional career. I went to medical school there. I did my training at Columbia, spent a few years at the NIH, and then returned. I ran the Division of Endocrinology for almost 30 years. And within the endocrine division, I was the head of the metabolic bone disease program. So my career has been focused on the practice and investigation of diseases like osteoporosis. My interest in Armenia began about 10 years ago. It was my first trip in 2007. And that was a very pivotal moment in my life because I realized that there were many things that I could do with regard to my own specialty, recognizing that osteoporosis is not just a disease that occurs in people in this country or other countries, but all over the world. And in Armenia, there's a major problem. So a lot of my efforts over the past 10 years have been to try to make the people aware, the doctors aware of this disease, and to bring the technology and to train the doctors by which we can recognize this disease and take good care of our people in Armenia.
Now, Dr. Belizikian has also been the pioneer who has been able to get our approval for accreditations of our medical profession at the Columbia University, so that if that is introduced to the Armenian Heritage Cruise, we would be able to get credit for our attendance. And I would like him to say a few words about that.
Sure. Thank you, Raffi. The Armenian Heritage Cruise has had a medical component for the past 4 or so years. That means that there is a medical professional there giving lectures and talking about health problems in Armenia. This coming year, this will be 2017, for the first time, we're going to have actually a medical faculty. And this medical faculty will be giving several lectures each. We're going to focus on the health problems in Armenia as it relates to the global problems that are represented. And as Raffi said, the program will be accredited through Columbia University, which means that any healthcare professional who wants to come and register will get 10 hours of continuing medical education credit, which is a large component of what all of us have to give in accomplish in a given year. So beyond the cultural advantages of being on the Armenian Heritage Cruise, and there are many cultural advantages. I've been on 3 and I'm looking forward to the next one. There is the medical education side, which we think will even strengthen the program.
John, maybe you can mention a few of the professors that are going to be lecturing and their credentials, as well as topics that we will be discussing on the health program.
Yes, we have 4 faculty. I've mentioned my own area. I will be covering osteoporosis as it relates to issues in Armenia and the world. We have 3 other faculty. They are all very distinguished Armenians. Dr. Larry Najarian, I think many of you know Larry Najarian. He is an outstanding ophthalmologist. He is the president of AAHPO. Larry has had many interests and has been head of many medical missions in Armenia. Larry's going to be one of our faculty. He's going to talk about specifically the work that AAHPO has done in Armenia in addition to which he's going to focus on the eye issues, and certainly eye diseases, even to the extent of examining children in Armenia who don't have glasses. They can't see because they don't have corrective lenses. How are we getting that? How are we examining children in Armenia? There are many people, besides Larry, of course, who have been interested in eye care in Armenia, but Larry will be covering that.
And the other professors?
Yes, so there are two other faculty, Dr. Robert Bagramian. Dr. Bagramian is a former dean of the American University of Armenia, an outstanding dentist with also a PhD degree. And Bob is going to, again, he has been to Armenia many times, not just serving as Dean of the School of Public Health at the AUA, but he has also been heavily involved in the issue of dental care. Again, the problems in Armenia with regard to dental care throughout the population, but particularly in children, is a formidable one. And Bob and his team have regularly gone to Armenia. So part of the discussion on the cruise will be the problem of dental care in Armenia and what is being done to deal with that problem.
One more speaker that is from the American University of Armenia, that's a specialist on smoking and cessation of smoking.
Yeah, this is Professor Vardui Petrosyan.
Petrosyan, yes.
Yeah, and Dr. Petrosyan is the current and recently appointed Dean of the School of Public Health at the American University of Armenia. Dr. Petrosyan received her PhD degree from Johns Hopkins, and actually Dr. Harut Armenian was her faculty advisor at Johns Hopkins. These four faculty, we will be addressing these issues as they apply to the local population of Armenia, because the cruise, of course, is focused on Armenia and Armenians, but also to put it in the context of the world view of these diseases, which indeed affect everyone globally.
I think that the American health professionals were also going to man some clinics where the visitors on the boat could come and consult them for their specific problems if they wanted to, with all the specialists that would be participating in the program. It is also a unique chance for a lot of the physicians not only to understand about what are the major problems that are happening in our homeland, but also to network to see how the interconnection of these physicians can be helpful in promoting the medical care in Armenia. I don't know how you feel about that, John.
Yeah. Yes, Dr. Hovanessian, that's a very important additional feature of this program. In addition to the accreditation, that is, the healthcare professionals who will be registering for their credits for medical education, we are going to also have an opportunity, as Raffi said, to have anyone, literally anyone, who comes to the cruise through the Armenian Heritage Cruise will be able to access us. We are thinking about having roundtables, and the faculty will be expanded, not just the four of us, because there will be others on the cruise. And we will be available. We will be talking about problems at levels that aren't just for the healthcare professionals. And we feel that this is one of our missions. And again, we would invite and hope that those who are thinking about coming to the Armenian Heritage Cruise, whether they are going to participate for credit, that is medical credit, or just to learn more about themselves and the problems that we're going to be dealing with, we would welcome them.
Of course, we should never forget about all the other available Armenian programs that are available for the participants, be it in the form of cultural, educational, lecture series, the dance groups, the entertainment, and having participated to at least 7 of those cruises, I can tell you that it is an occasion that is not to be missed, because if you participate once, as they say, you will register for the next year immediately. I hope that more of the physicians will participate in this program because that's how we're going to be able to increase our Armenian physician network. John, if you have any other additions to make.
I agree with Raffi. I have to say, when I first went on the cruise 3 years ago, it was love at first sight. I said to myself, this is so wonderful to be with our people, to learn from each other. Again, professional learning, cultural learning, entertainment. I immediately signed up for the next year, and I am going every year without fail.
And I think that if someone as busy as Professor Belizikian, who has at least gone to Armenia on 2 occasions per year, as well as travel all over the world, including North, South Pole, North America, South America, Europe, if he has time to go to this 7-day cruise, I think a lot of us should get time to be able to participate. Thank you.
Yeah. Thank you very much.